Good morning, everyone. Welcome to the Institute for Work and Health Speaker Series. My name is Monique Gignac. I'm the Scientific Director and a Senior Scientist at the Institute, and I'm delighted to welcome my colleague, Dr. Arif Jetha, as a speaker for our session today. Before I tell you a little bit more about him, I'd like to just go through some of the housekeeping for the presentation. The first thing is that recording and slides will be available after the presentation, probably about a week or so from now. So you will be able to get access to those. If you need the closed captioning or like to use it, you can find it at the bottom of your screen, likely under the More button. And the way we typically handle the presentations is that Dr. Jetha will give his presentation and will hold questions until the end. Would love to have your questions and comments. So if you do want to participate in that, please type your question in the Q&A box at the bottom of the screen. And I will try to get through as many questions as I can in the session. We often do get a lot of questions, so I would encourage you, if I am not able to ask your question, to contact Arif directly. You can ask him about the presentation that way. And often, because questions are similar to one another, I may try to bundle a few different questions that are all on the same theme so we can kind of get through more of them. But please do ask questions, give us your comments. At the end of the presentation, Arif will get all of those sent to him as well. Okay, so questions in the question and answer box, but let me tell you a little bit more about Dr. Jetha. He is Associate Scientific Director and Scientist at the Institute for Work and Health. He's also an Associate Professor at the University of Toronto's Dalla Lana School of Public Health. Dr. Jetha's program of research aims at understanding how sociopolitical, technological, environmental, and economic changes that characterize the future of work affect health and employment participation of vulnerable workers. He's specifically interested in the implications of artificial intelligence on the health, safety, and well-being of workers. And today he's going to talk about some research that focused on surveying the landscape for AI use in occupational health and safety in Ontario and British Columbia. Welcome, Arif, and over to you.
Thank you so much for that wonderful introduction, Monique, and thank you for those who are attending today. I'm delighted to be presenting some of this kind of new and emerging research that we just collected. So there's evidence of growing AI adoption within diverse Canadian workplaces, yet in the field of occupational health and safety, we actually know very little about the extent to which AI is being used and its effectiveness in protecting and promoting the health, safety, and well-being of workers. And so the goal of today's presentation is to get a lay of the land by describing findings from a survey of health and safety professionals in Ontario and British Columbia, where we asked about AI use. I'd like to start by acknowledging funding support from the Workplace Safety and Insurance Board in Ontario, as well as WorkSafe BC in British Columbia. I'd also like to acknowledge our research and partnership team, which includes stakeholders from Ontario's health and safety system, which provided a lot of feedback at the outset of this research and has been a valuable partner as we've moved this research and several other studies in the area of artificial intelligence forward. So to provide a bit of context of where this research came from, this research actually we present on today emerges from a research agenda that we set in 2023 and was co-designed by a team of multidisciplinary researchers and stakeholders. Collaboratively, our team identified 4 key research areas which reflected critical knowledge gaps related to artificial intelligence, work, and worker health. Agenda Area 1 aims to understand the occupational health and safety implications of AI and the impact of decreasing human worker autonomy. The second agenda area aims to advance responsible, safe, and healthy AI from an occupational health and safety perspective. Agenda Area 3 aims to build a policy-relevant evidence base on AI, worker health, safety, and well-being. And very lastly, Agenda Area 4 aims to examine and address worker knowledge needs related to artificial intelligence and occupational health and safety. So our team at IWH is actively pursuing research to build evidence in each of these agenda areas, including the research I present on today. Our research agenda was published in the American Journal of Industrial Medicine, as well as several plain language articles, and I believe links will be dropped in the chat so you can access those directly. They're all open access. And we encourage you to take a look if you want to learn more about the context of our research. We also want to flag that over the next few years, we plan to share findings from a number of different studies on the topic of AI. So if you're interested in research on AI and work and health issues, please do stay connected with us, subscribe to the Institute's e-alerts, where we often publish and post about new research findings. Also, I wanted to start this presentation by providing a bit of a background on core concepts. And the goal is to level set our understanding of AI and the role it can play within the workplace before we focus in on the occupational health and safety lens. So at a broad level, AI is an umbrella term referring to the use of computing machines to solve problems traditionally requiring human intelligence. Within this kind of umbrella, we have machine learning, which is a subset of AI, and that involves using algorithms to find patterns in structured or unstructured data with the goal of making predictions. Deep learning, which is a subfield of machine learning, uses neural networks, which are algorithms that are structured like the human brain, and they can stimulate more complex decision making. Innovations in deep learning, including the use of large language models, have been at the forefront of machines being able to match or surpass humans in performing certain types of tasks, including those involving image and speech recognition. And so as you can see, the foundations of AI are kind of threefold. The first being algorithms, the second being data, and the third being computing power. Algorithms represent a set of mathematical rules to identify patterns in data. And data itself includes numbers, images, text, or audio, which can be used to actually train the AI models or have them learn. The design of algorithms and the selection of data to train AI determines AI performance. And what we know is that rapid advancements in computing power have been at the heart of recent AI growth and have enhanced its ability to train algorithms on very large and complex data sets. One thing to note is that AI is often being utilized in conjunction with other technologies, such as mobile devices, sensors, robots, cars, or Internet of Things devices. So kind of untangling its functionality can be quite challenging for some. And so what we know is that there are examples of AI applications across virtually every Canadian industry. These examples show several key lessons that I want to kind of highlight in this slide. First, AI at work can be used to augment job tasks or enhance the work performed by human workers across a broad range of occupations, including those with physical or more cognitive demands. For some occupations, AI may be optimized to perform the most strenuous job tasks. For others, AI may be used to fully automate job tasks. Given its impact on the workplace, AI is expected to redistribute and reorganize work activities between human workers and machines. And also, it's expected that AI will change the working conditions to which humans are exposed. One thing I also want to highlight is that there are an increasing number of established risks of using AI that can emerge from the design, the training, or the application of the technology. For instance, biases in the technology can contribute to an unequal distribution of AI benefits. AI models can hallucinate, where they generate incorrect or misleading information, or may malfunction and contribute to unanticipated outcomes. AI can also be used in ways that might not be intended by the designer of the tool. The requirement for ongoing data collection can raise privacy concerns for some. And the changing conditions at work that stem from AI have the potential to create hazards that we have yet to fully understand. To note, many of these AI risks have not been examined from an occupational health and safety perspective, and their impact on human health, safety, and well-being are poorly understood. So taking into account the applications and risks of AI presented in these earlier slides, there are several ways in which AI can be used as a tool to advance occupational health and safety practice within organizations. So first, AI could potentially be used to predict an OHS risk, and we could think about image capture systems, which are constantly scanning high-risk workplaces and identifying potential hazards before an injury occurs. The ability to consume and analyze large amounts of data could mean that AI holds promise as a tool to diagnose underlying causes of complex occupational health and safety incidents and support evidence-based decision-making. AI may also be used to automate hazardous tasks and could potentially or partially or fully remove workers from some of the most unsafe situations. At the same time, a recent systematic review led by our team found that there's actually very little evidence on the impact of AI OHS tools on worker health and safety and well-being outcomes. So we're not really sure the actual real life implications of these tools. What we also found in our systematic review is that many of the AI tools that exist are prototypes that are still being tested, or many AI OHS tools are being launched by private corporations, where it's actually hard to audit the design of the tool or determine its efficacy. Despite these gaps, there's growing discourse among health and safety professionals on the role AI may play in addressing complex health and safety challenges. So there is something there that we need to understand a little bit more. And so to build an evidence base and to describe the current landscape of AI use in the field of occupational health and safety, our research aimed to address three interrelated research questions. First, to what extent are health and safety professionals using AI for occupational health and safety within their firms? Second, how do health and safety professionals perceive AI for OHS? And how do those perceptions of AI relate to whether or not AI is used? Third, what are the firm level factors most significantly associated with AI use in the space of occupational health and safety? And so addressing these questions is a focus of the survey which I present on today. To answer these study questions, we conducted a survey of health and safety professionals in Ontario and British Columbia in the summer of 2024. Participants were recruited using the Leger Opinion Panel, which is nationally representative and allowed us to capture a relatively diverse sample. All participants completed a 20-minute survey about the characteristics of their firm, AI utilization within their firms, perceptions of AI, and occupational health and safety contextual factors. And so I'm going to describe some of these survey items and measures as I present the study findings in the following slides. And so just to note, we recruited about 810 participants. Most were supervisors, senior managers, or executives who indicated having some or many OHS responsibilities. Other participants included OHS practitioners like industrial hygienists embedded within a workplace, HR representatives, or union representatives. And one key kind of defining feature of all of our participants is that they all noted that they are responsible for some degree of health and safety within their workplaces. Let's now dive into some of the specific survey findings. One of the main goals of our survey was to examine AI use and perceptions of AI. And what we found was that just over 1/4 of participants reported that their firms used AI for occupational health and safety purposes. About 54% of participants indicated their firms did not use AI for OHS purposes. And about 17% didn't know if their organization was using AI for OHS purposes. Interestingly, as described in the graph on the left of the slide, a slightly greater proportion of participants indicated that their firms used AI for any purpose. So this could be to automate job tasks or to perform any other function within the workplace. And this might suggest that while AI might be used at work, the technology may not be widely applied to OHS activities at this time. Among AI users specifically, we asked participants to describe some of the ways in which they utilize the technology for occupational health and safety. Some of the most frequently reported reasons for using the technology included to monitor safety behaviors. And so some participants discussed using AI-enabled smart cameras and sensors. Other participants indicated using AI to promote health-enhancing behaviors. Some participants talked about using an AI worker mental health monitoring and assessment tool as an example of a way that they were promoting health-enhancing behaviors at work. AI was also used by participants to prevent psychological injuries. An example included a large language model therapy application noted by one participant, whereas other participants frequently reported using AI to eliminate hazards. Some participants talked about using automated fire suppression systems that were AI enabled. Among participants from AI using firms, 7 items designed by our team asked participants to rate the extent to which different factors motivated the decision to adopt AI for OHS. For the most part, participants rated all 7 items as being highly motivating in their use of AI for OHS. Most prominent motivating factors included using AI to provide insights from data, to perform OHS tasks more consistently, to modernize health and safety practices, and to improve worker health and safety outcomes. Next, we asked all 810 participants to rate their perceptions regarding the impact AI could have on OHS outcomes within their workplaces. As indicated by the blue bars, participants from AI using firms held significantly more positive perceptions regarding the impact of AI on occupational health and safety, including its impact in creating a safer workplace, in minimizing OHS costs, and its impact on minimizing physical and psychological injuries at work when compared to participants from firms not adopting AI, as indicated by the yellow bars, or when compared to participants who didn't know whether their firms adopted AI, indicated by the gray bars. A series of questions on the perceptions of the benefits of AI and the role AI plays within workplaces were asked using 13 items, which I will present on these next 2 slides. And so participants were asked to rate their level of agreement on each item. And what we found was that when compared to participants from non-AI using firms, participants from AI using firms for OHS, and that's indicated by the blue bars, held greater knowledge regarding the role AI can play at work and were more likely to agree that AI would be beneficial to their workplace. Participants from firms using AI for OHS were also more likely to agree that the benefits of AI would outweigh any disadvantages. Again, as indicated by the blue bars, participants based in firms using AI for occupational health and safety were more likely to agree that AI could partially or fully perform job tasks that make up an occupation within their workplace. Participants from AI using firms also reported greater levels of comfort in relying on AI for work, including using the technology to make decisions, providing instructions to workers, or using AI to support work tasks when compared to participants from non-AI using firms or from firms where they didn't know about AI usage. Using another set of items we developed, we asked about the concerns regarding AI use and asked participants to rate their level of agreement regarding each concern. When taken together, participants from AI using firms reported significantly greater perceived concerns about AI design and adoption than participants from non-AI using firms. Notably, participants from AI using firms reported that high costs, a lack of understanding of challenges and benefits of AI, and a lack of technical expertise required to adopt AI tools were specific concerns they held regarding the technology and its utilization for occupational health and safety. So next, we compared firm-level characteristics that differentiated AI using firms from non-AI using firms. And again, the focus was on use of AI for occupational health and safety. And what we found was that firms based in Ontario were more likely to report using AI for occupational health and safety purposes, and that's as indicated by the blue bars, when compared to firms based in British Columbia. Next, we compared AI utilization by firm size, which was determined based on employee numbers. We found that a greater proportion of large-sized employers reported using AI for occupational health and safety, whereas a greater proportion of small-sized employers were non-AI users. Next, we examined AI usage according to industry. Industries were classified into 3 groups: primary, which included agriculture, mining, and forestry; goods producing, like manufacturing; and sales and service industries. And we found that non-AI using firms made up the greatest proportion of firms across each of the industry categories, as indicated by the yellow bars. And we saw no meaningful difference in AI use for OHS when comparing these 3 industry groupings. Lastly, we compared AI usage according to work location, including whether firms required their employees to work primarily at work, primarily remotely, or in a hybrid work arrangement. And we found that non-AI using firms made up the greatest proportion of firms across each work location category, as indicated by the yellow bars. To note, the proportion of AI using firms was highest among those offering a hybrid work arrangement when compared to firms requiring their employees to work primarily at work or primarily working remotely. So to examine firm-level occupational health and safety contexts, we asked a series of questions regarding organizational commitment to OHS and workplace hazardousness in relation to AI usage. Using 8 items, we asked participants to rate the frequency to which their organization utilized strategies to foster occupational health and safety. Example items included asking participants about the frequency with which unsafe conditions are addressed within their firms, work cleanliness was maintained within their firms, or supervisors within their firms were offered OHS training. So again, the frequency with which these happened. And in this graph, we show the number of times in which a participant reported that their firm frequently utilized an organizational OHS strategy. And what you can see is that for the most part, based on participant responses, AI using and non-AI using firms were similar in terms of the extent to which they utilized organizational strategies for occupational health and safety. We did, however, find that a greater proportion of participants from AI using firms reported that their organization used 7 or more OHS strategies with high frequency, when compared to non-AI users. So accordingly, there's a bit of a deviation here between AI using firms and non-AI using firms that are most responsive to OHS, so those at the kind of the right-hand side of this line graph. Additionally, we examined the hazardousness of each firm using 10 items. Items asked about the frequency to which a participant was exposed to a particular hazard, such as heavy lifting, working from heights, or being exposed to hazardous chemicals. In this graph, we show the number of times in which a participant reported a high frequency of exposure to a hazard. We found that a greater proportion of AI users were in the high hazard group, indicated by the gray bars, meaning they were exposed to a greater number of hazards at a high frequency. In comparison, participants from non-AI using firms were more likely to report being exposed to a moderate or low number of hazards at a high frequency, indicated by the yellow and gray bars respectively. Finally, to complement our descriptive findings, we conducted a multivariate logistic regression model to examine the factors associated with firm-level AI use for occupational health and safety. Conducting a multivariable model allowed us to adjust for the different firm-level factors described in these earlier slides to produce independent associations. For these models, we removed participants who reported they didn't know if AI was being used for occupational health and safety within their firms, which could have potentially skewed the findings. So in this slide, we highlight factors that were significantly associated with organizational AI use for occupational health and safety emerging from our models. And just to orient you a little bit, the yellow dots represent odds ratios, and the black lines represent confidence intervals. An odds ratio over 1 indicates a greater odds or likelihood in the association between a factor and the outcome. So in our case, the outcome is whether a firm used AI for occupational health or safety. Model findings were adjusted for firm-level descriptive characteristics, OHS factors, and perceptions of AI. Our models confirmed several key associations highlighted in the earlier descriptive slides. And so when adjusting for different factors, firms in Ontario had a 1.66 greater odds of AI use for occupational health and safety when compared to British Columbian-based firms. Also, large firms had a 2.42 greater odds of using AI for occupational health and safety compared to small-sized firms. Our models confirmed the association between work location and AI usage. Firms with hybrid work arrangements had a 1.85 greater odds of using AI for OHS when compared to those with the requirement for workers to show up to the workplace. Unsurprisingly, our model emphasized the relationship between those reporting that AI would have a more positive impact on organizational OHS outcomes and the likelihood of a participant reporting that their firms used AI for OHS. Lastly, and notably, our models highlighted a relationship between moderate and high hazardousness of a firm and a greater likelihood of using AI for OHS when compared to low hazard firms. In particular, firms characterized as being moderately hazardous had a 1.94 greater odds of using AI for OHS when compared to firms with low hazardousness. Also, firms characterized as being highly hazardous had a 3.23 greater odds or likelihood of using AI for OHS when compared to firms with low hazardousness. Of note, based on our models, and not presented here, industry perceived AI concerns and organizational OHS responsiveness were not significantly associated with AI use for occupational health and safety. So these are factors that were not significantly related to this outcome. So what can we take from some of these descriptive findings that we presented in today's presentation? So despite the discourse of the growing utilization of AI within Canadian workplaces, AI use for occupational health and safety is not as common as I would have anticipated among the survey sample, with close to only 1/4 indicating that their firms used AI for occupational health and safety. However, we might anticipate that as AI becomes more affordable and widespread, new AI-powered OHS tools will be developed and deployed over the coming years. And so if we were to rerun this study in the next few years, we might predict that the proportion of participants indicating using AI for OHS might increase. But obviously, more research is needed to kind of track utilization over time. Firms adopting AI for OHS in our survey were characterized as being larger and potentially more hazardous. It might be that the most safety-sensitive organizations may be looking towards AI to address complex occupational health and safety challenges, and to protect workers who may be particularly susceptible to injury or illness. Also, larger organizations may have more resources to allocate towards OHS innovation. At the same time, we know that a sizable proportion of firms in Ontario and British Columbia are small or medium sized. And so I think as an important future step, we need to explore the potential role that AI can play in occupational health and safety needs within firms ranging in different sizes. Lastly, we found that hybrid workplaces were more likely to utilize AI. And so this is something that we're still trying to unpack in greater depth. But it could be that workplaces willing to adopt a hybrid work arrangement may also be more open to exploring how new technologies can enhance workplace practices, including those related to occupational health and safety. Also, the requirement for hybrid workplaces to have staff work both in person and remotely may mean that they are likely to turn to new tools to advance workplace processes and maintain productivity. Hybrid workplaces might also just have relevant systems in place to foster technological adoption. But again, these are my interpretations of this data. I'd be curious to hear what others in today's speaker series think about this relationship between hybrid work and AI utilization for occupational health and safety. So based on our research, we're still really at the early stages of understanding the role AI can play for occupational health and safety and building tangible recommendations for OHS professionals who are considering using the technology in practice. Based on our work in this area and the study findings that I present on today, I think there's several future steps that we ought to take that emerge from the research. First, I think there's value in determining the utility and effectiveness of AI for a range of OHS problems, including the extent to which AI can be used to detect a broad range of physical, chemical, psychosocial hazards within the workplace, the role it can play in promoting safety behaviors, or as a tool to examine patterns in data. So I think there's still kind of more research that needs to be conducted to examine the utility of the technology. Second, we need to explore how AI may shape OHS outcomes across a range of firms, including firms which may differ according to size, hazard profile, or worker composition. Research across these various settings can help us elaborate on the strengths and limitations of AI and help identify groups of workers or workplaces that may benefit most from the technology, as well as those that have the potential to be harmed by the application of the technology. Uh, Relatedly, and as presented earlier, there are a number of hazards that can emerge relating to AI adoption. For instance, biases that can emerge with the design of the technology, hallucinations, privacy concerns. We need to expand our understanding of the occupational health and safety implications of these AI risks. Our study findings suggested that AI users may actually be more savvier and as a result could be more aware of both the advantages and disadvantages of the technology when compared to non-AI users. It's important that as the AI landscape expands across Canada, all OHS leaders build AI literacy so that they are more fully able to contribute to organizational decisions on the design and adoption of the technology, with the goal of better protecting workers and making workplaces more safe. Lastly, AI applications are advancing at a rapid speed. We need to continue to scan ongoing technological transformations as well as emerging AI tools to determine how they may be utilized to improve occupational health and safety outcomes, as well as related harms. And as things continue to change, I think this will be an ongoing area of research that we need to kind of keep up with as a field. And so with that, I wanted to thank everyone for participating in today's speaker series. I was delighted to present on some of these novel and new findings. And I'm curious about some of the questions and reflections you might have. And so I'm going to now hand it over to Monique to facilitate the question and answer period.
Okay, thank you very much, Arif. Great presentation. We do have some questions that are coming in. For those who joined a little later, if you do have a question, feel free to type it in the Q&A box. And if we don't get to your question this morning, feel free to email Arif directly. And the presentation and slides will be available later this week. So first question, Arif, you mentioned at the outset of your presentation a number of ways that organizations were using AI in terms of things like monitoring safety and so on. A question about promoting health enhancing behaviors. Do you have any examples of what that looked like, what people were doing using AI to do that?
Yeah, so we collected a lot of open-ended data, which our team synthesized to kind of provide those types of insights. And so I think one I guess one response is I would ask that the person send me an email offline, and I'll kind of send you the specific examples. But some of the things that we heard were health promotion chatbot tools that were powered by AI and that were responsive to specific health needs as well as demographic characteristics of the worker. We heard about mental health applications like mindfulness applications that were powered by AI and were aiming to identify kind of mental health challenges that were articulated by the worker and then providing tailored recommendations to that worker. So these were just some examples that were utilized. And I do want to caution you, what would be important to highlight is that the effectiveness of the tool is yet to be seen. So the goal for this specific research was just get a lay of the land. And I think the next step is to understand how effective these tools can be in actually shaping health outcomes.
Okay, thank you very much. Someone has asked whether you have some additional insights from your research or other studies you've done as to why there were differences between Ontario and BC in using AI.
Yeah, I think that'd be something that I'm interested in exploring a little bit more. Uh, Initially, our team thought it might just be based on like industry composition, but as you could see in our model, we actually adjusted for industry, and the relationship between being in Ontario and AI usage was still higher. And so it could be a cultural thing, like workplaces in Ontario might be just more open to adopting AI tools. One thing to note is that this was a sample of participants that were willing to answer questions on AI. So there are some sample composition aspects that are worth considering. And I think just in general, I think this is maybe something that we need to think about more broadly, is like the differences in AI usage across different regions in Canada. And I think this brought that to life, and just requires, I guess, further examination and further studies so we can unpack it a bit more.
Okay,
And
we've got
I
lots.
know that's not like not a tangible response, but it's hard to kind of infer what the differences are without exploring it a bit more.
Okay, thank you. And we have lots of questions coming in. Thank you to everyone. Someone has a great presentation. Can you cite the most AI used technology in this survey? Did people give examples? You said you had a fair bit of open-ended responses.
Yeah, I can maybe go back to that screen because I think that's of interest to many people. I think the one that was most frequently discussed by AI users were tools to monitor safety behaviors. And so these included smart cameras or sensors within the work environment that were enabled by AI. And what they tended, or what participants tended to talk about, was the kind of the ongoing scanning of a work environment to ensure that workers were complying with like PPE, personal protective equipment adherence, that they weren't kind of in an unsafe situation. They weren't kind of lifting or moving things in ways that were unsafe. And so this just required ongoing kind of scanning of the work environment. And oftentimes using AI tools, the AI could kind of scan images or video clips to identify unsafe situations. Also, we have like the promotion of health enhancing behaviors, which we talked about earlier. Participants talked about the use of AI to prevent psychological injuries at work. So we talked about the use of like chatbot devices or large language model therapy applications. So these were just some of the most frequently discussed applications based on our survey sample.
Okay, thank you. Did your survey go into more details about the ethics piece? You mentioned privacy, but some of the
Yeah.
ethics about using AI for OHS, and what did you find, or do you have plans to look at this in more detail?
Yeah, so definitely we want to look at it in a bit more detail, and maybe I can pull up the slide where we asked about concerns about AI. So this is this is the slide on AI concerns. And as you can see, the ethical concerns is the group in the middle. So we did ask participants to rate their perceptions of the concern regarding the ethics of AI. It wasn't the most prominent theme in terms of AI concerns, but it wasn't one that was kind of tossed to the side. So it's clear that AI users definitely saw this as being a concern, as well as non-AI users. So it is a theme that requires a little bit more investigation as we move forward. And obviously issues related to AI biases, the the data that's used to train AI models, it all kind of feeds into this discussion on ethical concerns. And so it is a theme that requires greater exploration. In our research team, we have an ethicist who's involved, and we're working with them directly to kind of unpack some of these key issues a bit more.
Okay, thank you. This is not directly about the survey, but someone is asking whether you're aware of if at a technical level, can AI self-audit and self-correct, or does it need to have kind of people oversight?
It's a good question. I'm not an engineer, so I'm just going to preface this. We're looking at AI from more like a macro level in terms of its applications, and so the ways in which it's designed is kind of beyond my skill set, and or I maybe not feel comfortable to address that question directly. But what I would say is if that person sends me an email offline, we have some members of our research team who are a little bit more skilled to answer questions about the technical design of AI tools and the capacity for it to self-audit. That being said, it's important to highlight that algorithms are created by human agents. The data that's used to train an AI is often selected by humans. And so these types of decisions can determine the effectiveness of the tool, whether or not it's equitable when it's applied to diverse individuals. And humans play a critical role in auditing the extent to which the AI is causing harms. It's having advantages for some, but maybe not others. And so this kind of ties into my point about the role of AI literacy. It's important for health and safety professionals to be aware of how the tools are being designed. What are the factors that are being included in the algorithms? What are the data? What data sets are being used to train it? And that'll help them inform decisions that their workplaces are making when they're utilizing these types of tools.
So just following up on that with a couple of other
Mhm.
questions. If you've got something that's kind of hallucinated and it's created some information, it's misinformation, does it just now keep using that as it becomes self-perpetuating and it's hard to get rid of this because it almost becomes truth? What happens there? How do people play a role in getting that out?
Yeah, so I think these are great questions. And this actually leads into research that we are actively conducting right now, which is
Hmm.
how to identify and address some of these themes from an occupational health and safety perspective. So again, I would say that it kind of aligns with this need to build literacy on the topic, because by building literacy on AI, on the topic of AI as it relates to occupational health and safety, we can better identify when these problems are emerging and work within our workplaces to identify opportunities or pathways to stopping the use of the tool or creating contingencies in times in which it might malfunction or create hallucinations. AI is a learning system. It will perpetuate over time. The data that we feed into it kind of creates the foundation. And as more data is fed into it, it's going to learn in the ways that the data is kind of informing it. So it's definitely a concern, but it's one in which we honestly have not studied from an occupational health and safety lens. And so we see this as an important kind of opportunity for research moving forward.
Okay, thank you. So someone is asking about the role of OHS regulators and whether you're aware of whether or not they are currently involved in updating regulations, for example, for AI use. And do you see that in your research, or do you have recommendations for whether or not this needs to be more of a role that particularly of this group?
Yeah, this is a really good question, and one that we actually have a paper that's under development where we've scanned OHS regulations across like high and middle income countries. And what we found in that specific paper was that there's actually very few national policies that exist that are aimed at workers and workplaces in general. The one that I would highlight is in the European Union, which there's an AI Act which was recently enacted, but that in itself is focused broadly on labor issues, not specifically on occupational health and safety. So from our view, there there isn't much specific regulation being developed with regards to AI and occupational health and safety. And I think it just highlights the importance of this evidence to kind of bring light to those gaps and to kind of create an opportunity to work alongside folks within the Ministry of Labor in Ontario, as well as in other regions, to kind of help develop these types of regulations. Canada has an emerging AI kind of act, but again, occupational health and safety is not part of that. It hasn't been passed yet. And so this conversation is one that it's emerging. But I guess one thing to highlight before I end my response to this question is that the AI and the technology is advancing at a more rapid rate than the policy, and so that highlights another critical kind of issue that maybe we're not keeping up with the advancements in the technology and the use of the technology in the field.
Okay, thank you. That's hard to do. It's changing so fast, isn't it?
Mhm.
The technology, that is. Sorry, did you catch that?
Yep.
Okay. Someone is asking about barriers to AI adoption, and can you talk more about what you heard in this survey or in research in general about those barriers?
Yeah, so we asked participants to talk about the concerns that they faced with regards to AI adoption. And actually, one thing you might have noticed in some of the findings was that not that participants from AI using firms were more likely to not only talk about the benefits of AI to occupational health and safety, but they were also more likely to reflect on the concerns associated with the technology. And to me, that highlights that when you're more exposed to the tools, you're kind of working with it in practice, you start to see both the advantages and the potential harms that can emerge with the technology. And so issues related to cost was one that was brought up quite a bit. Issues related to technical capacity, like if we're thinking about small and medium-sized companies, we might not have the technical capacity to like incorporate AI tools into our occupational health and safety practice. And so these are some of the kind of the big themes that popped up. But that being said, I think some of these potential disadvantages, we should also kind of explore the advantages that this tool has and kind of balance the two in making these decisions. And so again, it goes back to kind of better familiarizing ourselves with different tools that exist, seeing the ways in which they might fit within your workplace, and then being able to audit their efficacy once they are applied.
Okay. A couple of people have asked whether or not you're seeing AI being used in disability management.
Yeah, we had asked about the extent to which it's used in disability management, and we found that relative to other kind of health and safety activities, the frequency to which AI-informed disability management tools were utilized were far less. So, fewer numbers of participants reported using AI-enabled disability management tools. Those who did talk about using AI-informed disability management tools were more likely to talk about using like decision support tools. So those that kind of will scan complex data sets, disability claims, and then inform decision making on the topic and inform organizational planning related to disability management. So that was like the only theme that emerged related to that topic, but it was far less than some of the other applications that we highlighted.
Right. Okay. Someone is asking, you had talked a bit about sectors, but did you see a difference between government workplaces versus the private sector? And do you know if there's research being done on that?
Yeah, that's a good question. Our sample, even though it was 810 participants, it's still relatively small. And then when you start looking at individual industries, the ability to compare becomes a bit more challenging. And so we grouped it into three kind of broad categories, as you might have noticed. I can if the person messages me offline, I'd be happy to like look into that a little bit more. I don't think I can answer that question off the cuff, but happy to kind of explore that a bit more.
Lots of questions here. So we'll
Mhm.
try and get through as many as we can in the next few minutes. Someone is asking whether or not you feel that respondents or practitioners in general may be reluctant to use AI for OHS For a variety of reasons, things like the specificity of workplace hazards, the reluctance of employees to consent to having private information used or to using AI, to sort of our lack of understanding of these tools and what it means. Have you been hearing things like that?
Yeah, those are specifically the concerns that were raised. Now, maybe I can go back to that concerns slide because I think that kind of summarizes some of the kind of key themes that this person is asking about. Uh, a lot of the themes that they're addressing were concerns reflected by by participants who are in the non-AI using group. And so they're clearly on the radar of those who are exploring the utilization of the tools. And in my view, as someone who's kind of spent time in this space, they should be critical factors in determining whether or not OHS professionals are using AI tools. We should be really critical about the extent to which workers might be benefiting from it or being harmed by it. We should be thinking about cost, technical capacity. We should be thinking about ethical concerns, potential malfunctions that can occur. But that being said, like sometimes some of the most complex occupational health and safety issues call for kind of innovation, and to me, this technology provides us, or it could be a way that we can innovate or modernize our health and safety practices. And so we should be really critical about the weighing the pros and cons, but we should be looking towards it as a potential way that we can improve occupational health and safety practice.
Okay. Someone is asking about who actually filled out the surveys. Was
Mhm.
it employers? Was it employees? Was it a mix of both? Do you have a sense of that?
Yeah, I can maybe go back to our respondents. So again, we had about 810 respondents. And so when we went to the survey research firm, we asked them to identify people who are responsible for occupational health and safety within a workplace. And so given that workplaces are quite diverse, we know that the person responsible for OHS within the different workplaces often differs. And so uh, based on what we identified in our survey, the folks that were kind of most prominent were supervisors, senior managers, or executives who are responsible for occupational health and safety. We also had folks who are kind of more traditional practitioners in the field of occupational health and safety. Some individuals were human resource managers, and then we had folks who were kind of falling within this other category. So they were kind of diverse, and then we had a small handful that chose not to disclose their job role. But regardless, the key kind of feature that was consistent across all respondents was that they explicitly stated that they are responsible for occupational health and safety within their organization, or they have some degree of responsibility on the topic.
Okay. Just to let you know, there are a number of people who are very interested in AI literacy and improving their literacy, asking
Mhm.
about the Institute for Work and Health, doing research in this area. We also have someone from IRSST in Quebec who has noted that they also are preparing materials on this as well. So just want to acknowledge that. But then ask you, do you have tips on how we can, as OHS professionals, increase our AI literacy, where we can go right now?
Yeah, so this has become a pretty critical priority of the government of Canada. So there are several AI organizations that exist that are offering kind of like micro credentialing courses that are free to access or are at a really minimal cost that I would say are helpful. And if folks are interested in learning more about them, they can email me and I can connect you with those specific training programs because some of the folks who are offering those courses are our research partners. But I will say that in the space of occupational health and safety, there's no like specific training programs, and so maybe this is something that I'll kind of flip out to some of our partners in the field that there might be a great opportunity to kind of take some of this evidence and develop OHS specific training programs that are tailored to our community. And I think that's kind of a critical next step. And again, I want to highlight that all of our kind of literature reviews on this topic have suggested that our field is kind of at its infancy and engaging on this topic. There's kind of a need for greater evidence to inform some of these resources to help folks in the field kind of build capacity and better understand the OHS challenges and opportunities. But in the meantime, there's broader training that I think I can link folks to if they're interested.
Okay, and you may have just answered this question, but I'll
Mhm.
ask it anyway because it's one that
Okay.
I think people are interested in. So thank you for the insightful and informative presentation. The individual is curious about um, common types of AI and whether we have any evidence about whether they're working. Are they more efficient? Are they efficacious? So you've talked about challenges, you've talked about they're being used, but are they making a difference? Are they making things better?
Yeah, that's a great question. And we have a systematic review, which is a synthesis of like high and medium quality research on this topic, where we ask that very specific question: Are AI OHS tools having a tangible impact on health and safety outcomes within the work environment? And I guess just a teaser: this paper is under peer review right now, so it's not widely available. But what I will say is that we only found two kind of applications that tested the efficacy of an OHS tool in a real life workplace practice. And only one of them was considered high quality in terms of the research itself. And so the other one, we couldn't infer the findings from them because of the biases that could be associated with it. So one study, and this was done a year ago, this research. And so what that says to me is that we know very little about how effective AI tools are. And so while we talk about the potential benefits of AI, I would also caution folks that we don't know in kind of real life settings what that means in terms of like the extent to which it'll prevent injuries or illnesses in terms of like actual outcomes. I'm not sure if there's like what the data. I can't kind of go one way or the other on it, but I will say that that's a caution that I would put forward. The other kind of theme that I highlighted earlier that I want to kind of remind folks is that a lot of the tools that exist that are available to occupational health and safety professionals are proprietary, so it's kind of hard to judge the effectiveness of these tools. And it's also hard to audit them and critique them because they're proprietary and maybe their like algorithms aren't publicly available. So that's a limitation, and that might impact our ability to kind of be critical in our application of the tool. So again, the AI literacy piece is critical because it'll allow us to kind of be observant of the strengths and weaknesses of the different tools that we're considering using.
Right, thank you. We're coming toward the end here. I'm sorry if I haven't got to your question, but a couple of people have asked, a few people, about whether or not is existing research, whether you're planning to do research that's looking specifically at outcomes for workers, stress, privacy, health, well-being. Are those things that you know of or are planning to look at?
So we have a study that we are launching this year, which is a living review of evidence. And what the goal is that we expect that over the next 7 years or so, that the evidence on the topic of AI will unfold. And so our goal is to frequently identify and capture research on this topic and produce insights that can be available to different groups of knowledge users. And so what I would say is definitely email me if you're interested in kind of learning more about some of these upcoming research studies. I would also say that we would encourage you to subscribe to our e-alerts where we will kind of share new evidence as it emerges. But that is certainly a focus of the work that we plan to do moving forward. And if you're interested in it, we are too. And so we would love for you to connect with us. That way you can kind of stay tuned to all the upcoming evidence that we hope to produce on the topic.
Okay, and maybe a last question, Arif. We'll see if we can get one more in after that, but maybe thinking of it as the last question. Were you surprised that you didn't see differences across industries as to whether AI was used for OHS? And, one might have expected, for example, to see a difference between manufacturing and healthcare versus other industries. Do you think more granular data is needed? What are your thoughts here?
Yeah, again, this is like our focus is on AI and occupational health and safety usage. And so the study wasn't focused specifically on utilization across like diverse workplace practices. And so perhaps it might be that the focus on occupational health and safety might be the reason why. And it might just be that only one quarter we're utilizing the tool. And so when we spread it across the different industries, the comparison, it didn't allow for like a robust comparison. I would expect that if we were looking at broad AI tools like those that were helping with automation, those that were helping with different types of decision-making practices, that we likely would see industry differences. But I think it just might be that we're still at the early stages of AI OHS tools. And so that might just be the reason why there might not be a difference between industries. But I'd also be curious to see what the person who asked that question thinks about it, because I think there's a lot of reflections that I have as I'm thinking about this data.
Okay, thank you. And maybe one last quick question,
Sure.
because a few people have asked about climate change. Are
Okay.
you seeing AI use and climate change, like as an occupational issue, being identified out there by in terms of what people are using or wanting to create?
Yeah, that's an interesting theme. We hadn't explored it, but I think there's a big discussion amongst AI developers about the energy that it takes to produce a really robust large language model. So this kind of intersection between climate and AI is pretty interlinked. It's not an area that I know much more about, so I don't think I can answer that question in a way that I feel comfortable doing so. But it is a theme, and it's one that I think will be explored. It's not one that I think we'll explore, but it's one that AI developers and different folks who are thinking about the societal implications of AI are thinking about. So if I see
And
good resources, happy to link with that person as well.
And something to think about. I think some of the
Mhm.
question was related to occupations that are affected by climate change, and using AI for those
Yeah.
occupations.
I see. And so, yeah, I think this like idea of eliminating workers from high hazard situations, that might kind of relate to the person's question then, that like if we're able to utilize an AI informed robot to kind of go into the most into like hot situations or areas that are kind of prone to climate disruption, that might be able to remove the worker. And so again, that's a potential opportunity that we might see in the future. But the effectiveness is still something that we need to think about a bit more.
Okay, I think that's all the time we have. Apologies if I didn't get to your question. I didn't get to all of the questions. My apologies, but RF will be getting a copy of all of them, and please do reach out. I want to thank everyone for joining us today, and thank you, RF, to you and the team who are doing this research and the ongoing plans that you have to continue in this area. I hope that everybody will join us in about a month on April 22nd, when we have our next Open Speaker Series presentation. That presentation will be given by Dr. Faraz Vahid Shahidi, and he will be talking about good jobs, bad jobs, and deaths of despair. So thank you very much for today's presentation. Please do join us again, and have a great day, everybody. Thank you.